morning. Welcome to this edition of San Diego People. I'm Logan Burns. Circulate San Diego just released a new report. It's titled Aging in San Diego, and it details how local communities can prepare and adapt to the growing senior population here in San Diego County. Joining us now to discuss the issue is Maya Rosas. She's the Director of Policy for Circulate San Diego. She's also the author of the study. So Maya, thanks for coming on. Appreciate it. How are you?
I'm doing great. Happy to be here. Thanks for having me.
It's our pleasure. Tell us about the study. How did you conduct it and what did you find?
Sure. Well, creating places for people to age in place is vital for San Diego's future. And so that was the impetus of this report. AARP and the World Health Organization have partnered to create a program called Age-Friendly Communities, which is a program to assist cities, jurisdictions, counties to create plans, policies, and actions so that seniors can age in place.
We're all getting a lot older, and the population is growing, the senior population.
That's right.
How is the San Diego area looking as far as what your study concluded?
Well, so our report, Aging in San Diego, it analyzed the state of San Diego for seniors, and it also looked at best practices from across the country. And so here in San Diego, our senior population is aging rapidly, which is no surprise. People are living longer and longer. So between 2012 and 2035, people age 55 and older, that population is going to grow by 194%. It's nearly double to over 1 million people. Okay. And so it's time for our cities to be planning to make sure that our older adults can live independent lives.
Sure. What do the cities need to do to help that?
Well, there's a range of ways, and so Age-Friendly Communities really focuses on the 8 domains of livability, and these domains cover topics ranging from the built environment and also
the built environment?
The built environment. So that means housing, that means parks, that means transportation, our streets, how people get around, and everything else you could imagine in our physical environment. And the 8 domains also cover the social environment. So how do we make sure that our older adults are able to be with their friends and have a normal social life?
So housing is a big issue. We know that there's a housing shortage, really. It's
Absolutely.
Very expensive to live here. And as you get older and older, nobody really wants to go to a home.
No.
I know I have parents, and you certainly want to be able to have them at the place where they want to live as long as possible. What is being done in the area to try to make that happen?
That is definitely a major priority for seniors in San Diego. So unfortunately, 35% of homeless people in San Diego County are seniors 55 and older, and that's not acceptable. So we, of course, need to be building more affordable homes for people of all ages, but especially for our seniors. And we need to make sure that housing generally is designed accessibly so that people can age in those homes instead of having to move someplace else where they hadn't lived.
How does your organization help achieve that goal? I mean, do you talk to politicians? Do you try to figure out a path so that more affordable housing will be built for seniors?
Right. Well, Circulate San Diego is an advocacy organization and a planning organization, so we can provide services to jurisdictions. For this report, we partnered with the San Diego Foundation, who provided funding for us to write this report focused on San Diego. And so Circulate San Diego can be a resource for jurisdictions who are interested in pursuing the age-friendly communities designation, and we want to help more cities become age-friendly.
What about Health and Human Services? What about helping seniors maybe get to a hospital or get to a doctor's appointment? Maybe they can't drive, maybe it's far away. What are you doing as far as that's concerned?
So part of the Age-Friendly Communities action planning process definitely involves looking at how to integrate various services. So for example, one city in the county of San Diego can't alone deal with all the health needs because they need to be integrated with the private sector, the private hospitals, as well as the county's Health and Human Services. So that is definitely a part of action plans, is coming up with how to integrate and make access the easy for seniors so that they can, again, live in their homes and have access to medical appointments.
Not only just traveling around using maybe buses and things like that,
Yes.
but just walking too. I mean, sometimes it's difficult. There's cracks in the sidewalks, curbs are high, not all curbs have those slopes. If you're in a wheelchair, it doesn't seem like.
Absolutely.
Is that part
Transportation,
of the issue too?
yeah, transportation is a huge part of age-friendly community planning. So to be able to reach medical appointments, for example, a city could work on partnering with the private sector or a nonprofit organization to provide specialized transportation services, lifts to get to doctor's appointments. But yeah, like you said, it comes down to even the need to make sure sidewalks are safe so that people don't trip and fall.
Are there some examples of cities that seem to be doing it the right way that you found in your study that you'd like to maybe help implement here?
Yeah, so in our report, Aging in San Diego, we looked at best practices, including places like Miami-Dade, which
a lot of people go to Miami to retire or Florida to retire. Yeah, you'd think they'd be the pros in this field.
They're definitely a leader. So, for example, something I thought was really interesting is they came up with a age-friendly park criteria to make sure that parks are age-friendly, accessible, that people could walk to them, inside of them. Make sure that there are activities for seniors in those parks. And so I thought that was a great idea.
What kind of activities? Chess, checkers, things like that, or
all of the above.
Whatever, yeah.
So what's really important in the age-friendly communities process is to actually engage with older adults. I wouldn't dare to assume all the needs of older adults. I'm clearly not one yet. But yeah, so the cities that take part in this process absolutely need to be engaging their stakeholders and make sure that they design parks, for example, to meet the needs community.
Sure. So what do you do as far as trying to get cities and counties to help with this? Do you meet with politicians? Is it just kind of just one of these endeavors where you're just trying to get them to commit to at least trying to do something that will help seniors more?
Well, so sometimes there's a champion internally in a jurisdiction who wants to make this happen. So, for example, in the city of San Diego, Councilmember Chris Ward is making sure that the city becomes an age-friendly community in partnership with the San Diego Foundation. But other times, there are seniors who want to see improvements in their neighborhood, and they will get in contact with their city council to try and make that happen.
Oh, terrific. Well, Maya Rosas with Circulate San Diego, thanks for coming on. I know we're going to see you in about 10 minutes. We're going to talk a little bit more about this. We're going to have to take a break.